Good morning, folks. I'm Myra Ansari here for Wave Now. Hope you're doing okay on this Wednesday. So many of you know that I like to talk about mental health and the importance of talking about it. So today we're going live to Frankfort, where Lieutenant Governor Coleman is commemorating NAMI Advocacy Day, and she's going to be joined by leaders from the National Alliance of Mental Illness. That's what NAMI is, Kentucky, to commemorate NAMI Advocacy Day. And also she's going to provide some information about how we are in Kentucky putting some more money and resources into Kentucky schools to provide mental health professionals to schools. So there's a press conference going on right now. So I'm going to show you a look at it. Right now they're just getting ready to get started to talk a little bit more about this. So it's going to be $42 million in federal funding to provide mental health professionals to schools in Kentucky. So let's just wait and stand by as they get started for this.
Good. All right. Good morning, everybody, and welcome to the Capitol Rotunda for our annual NAMI Advocacy Day here in Frankfort. We're very pleased that all you all could make it today and by this wonderful turnout. And this is always a special day each year for our organization. We have with us some very special guests today that are going to speak. We have some others that we're going to recognize, and I think we have a very special program put together. Several times we have been honored by the presence of our Lieutenant Governor of the Commonwealth, that she's here with us today, and later on we're going to be hearing from a variety of members of the General Assembly. As their schedules allow them to drop in, we just kind of have to pivot around that because a lot goes on up here. And today is probably one of the busiest days of this session in terms of the groups up here. Not only do we have our Advocacy Day, it's also City Day. There are city officials from around the state that are here today. I'd like to introduce now, the author Alex Haley said, find the good and praise it. And I tell you what, it's just been amazing to watch the energy and the enthusiasm and the whirlwind known as Jaden Norris operate. She's been to Washington, D.C. to advocate for us. She's met with our federal leaders. She's all over the state doing things. And she has just added such a vibrancy to this organization, and we are honored and thankful for her leadership. Jaden Norris.
Good morning and welcome, everyone. As always, it's heartwarming to see such a remarkable group of familiar faces and passionate advocates who are here to make a difference in the lives of those affected by mental illness. Your presence today speaks volumes about the immense support we have for mental health care and how committed we are to advocating for mental health in Kentucky. It's incredibly touching to witness the growing awareness and dedication to mental health. We all know that mental health is often pushed aside, overlooked, or even misunderstood. We all know that we are advocates today. This group right here continues standing together, united in the belief that mental health care is health care. Advocacy Day isn't just a chance to raise awareness. It's a day to prove to Kentucky that mental health deserves the same treatment as physical health. At NAMI, we are fully dedicated to empowering individuals that may be struggling. We know that mental health is not just a personal issue. It's a societal aspect that affects people from all walks of life. Each one of us knows either someone or has been touched ourselves by the impact of mental health. 1 in 5 adults in the U.S. live with mental illness. In Kentucky, that's 25% of adults. That means, statistically speaking, there's a high chance someone in your row is struggling with a mental health condition through themselves individually or a loved one. However, the gap in access to proper mental health care is still alarming. We see people facing barriers financially, logistically, and societally. I'm actually going to hold this. And that's where we come in. This is why we advocate for Kentucky's mental health parity law, which would prohibit insurance companies from treating behavioral health providers differently from medical providers. Mental health care should not be seen as secondary, and insurance should cover it as fully and comprehensively as any health condition. We also stand for ensuring that Medicaid funding is sufficient and that it specifically supports the mental health needs of Kentuckians. Nearly 40% of Kentucky's Medicaid beneficiaries live with a mental health condition, and yet many are still left struggling to find the access and care they need. They need investment in Medicaid funding, and that's clear. But even as we face these challenges, I want to acknowledge the tremendous progress Kentucky has made. In 2022, Governor Andy Beshear implemented the 988 Suicide and Crisis Lifeline in Kentucky. This is a monumental step toward providing immediate, compassionate care for people in crisis. UK Healthcare's opening of their first emergency psychiatric unit in Kentucky, known as the Empath Center. Additionally, we've made strides with Tim's Law and the establishment of mental health courts, including our Fayette County Mental Health Court, co-founded by our very own NAMI Lexington leaders. And Judge John Tackett, who is here in the crowd. Yes, thank you. These initiatives are changing the way our legal system interacts with individuals facing mental health challenges and ensuring they get the help that they need. These are monumental steps for Kentucky. So today, as we advocate for these essential issues, I want to extend my deepest gratitude for your support. Your commitment to the cause is invaluable, and together we are stronger. Together we can ensure that mental health care is accessible, equitable, and treated with the same respect as any health condition. So thank you again. Thank you for being here and for your unwavering support. We truly couldn't do this without you. I'm so grateful for each of you in this room today. And also thank you to Baptist Health Behavioral Health, Neurocrine Biosciences, and Leadership Lexington for making this day possible. Let's keep fighting for change, let's keep advocating, and let's keep making a Kentucky where mental health is prioritized and cared for the way it deserves. Thank you. Now, I am honored to introduce a champion of mental health, a lifelong Kentuckian, educator, basketball coach, writer, and founder of a nonprofit, and someone I call a friend. As the state's highest elected educator, she's a vocal and passionate advocate for public education. During her first term through Team Kentucky Student Mental Health Initiative, she worked with student leaders to secure more than $40 million in federal funding. It is a great pleasure to introduce Lieutenant Governor Jacqueline Coleman.
Thank you all. Thank you so much. And I have to tell you that when Jaden and TJ call, I answer. And certainly when NAMI calls, I answer. So let me begin by saying what needs to be said to you more often than you will ever hear it, and that is thank you. Thank you for your work. Thank you for your commitment. Thank you for your compassion and for the life-saving care that you provide, for the long hours, for the sacrifices that you and your families make. Thank you. Governor Beshear and I believe that accessible and affordable health care is a basic human right, and we believe that mental health care is health care. And we've backed it up with our actions. In our first week in office, Governor Beshear rescinded the Medicaid waiver, saving 100,000 Kentuckians who would have otherwise lost their health care coverage had we not intervened. We expanded Medicaid, and 400,000 Kentuckians were provided access to desperately needed and affordable health care. This ensured that nearly all of Kentucky's children were covered and had access to health care. And it meant that our neighbors didn't have to go bankrupt just because they needed to see a doctor for basic care. Medicaid is vital to our Commonwealth, particularly in our rural hospitals. And it is my hope that our elected leaders, both here in Frankfort and in Washington, D.C., do not go through with the rumored cuts to millions and even billions of dollars to our Medicaid programs across this country. It would be absolutely disastrous for Kentucky, and it would be especially disastrous for the rural communities in Kentucky. My focus in the Lieutenant Governor's office has been on youth mental health, and I gathered a group of students together and asked them to be our North Star for the Team Kentucky Student Mental Health Initiative. Through this initiative, being led by high school students from across Kentucky, we were able to secure $42 million for school-based mental health services across Kentucky. Because students are 6 times more likely to access healthcare services and mental health services when they are available in their school. We've worked with our federal partners, and even just yesterday, I met with a group of students who are completing their education because of this funding. I got to see it come to life. Real life mental health counselors who are about to finish their degrees and go out into our schools and provide for our students because of the work of the Student Mental Health Initiative. And soon they will be in schools across our Commonwealth. But I will not stop until every single child in Kentucky has access to the mental health care they need and deserve. I know that these past few years have been challenging, and I know that you are here today to advocate. So I would ask you in your advocacy to be bold on behalf of your communities, to be brave on behalf of the families who need you day in and day out. And today you get the opportunity to be their voice. This is your Capitol building. This building belongs to you, and the people who work here work for you and not the other way around. So as you advocate today, remember who you're fighting for, and don't stop fighting until you get what you know the people that you love deserve. And you can know that the governor and I will be right there with you as you are on this journey. So I will make this promise to you. We are going to keep investing in our communities, all of our communities, like never before. We're going to keep fighting for good paying jobs, to build the best economy Kentucky has ever seen and to keep it going, to make sure that our public schools have everything they need to serve every child in every zip code, to make sure that our communities are safe and that people have access to health care so that they can see a doctor when they are sick. And if we do that together, we can take the last few years of progress and turn it into decades of prosperity, understanding that the foundation of that prosperity is the health and welfare of every Kentucky family. Thank you for what you do. God bless you, and God bless Kentucky.
All right, we're going to make three very special presentations and recognize some individuals and organizations that have done amazing things in regard to mental health. Jaden is going to make the first presentation, and then we're going to ask Commonwealth Attorney Jonathan Gay to come up, and then I'm going to do the last one.
First, we're going to recognize NAMI's Business for Better Mental Health Award. This organization we recognize is deeply involved in advancing the understanding and treatment of neurological and psychiatric conditions. Their research and development of treatments for mental health conditions are contributing to meaningful progress. They have shown a commitment to supporting the mental health community through partnerships with patient advocacy groups and nonprofit organizations like us. Their collaborative efforts help ensure that the voices of those living with mental health conditions are heard, and they work toward making mental health care accessible and effective. NAMI Kentucky is proud to recognize Neurocrine Biosciences as our Business for Better Mental Health Award. Out of the back. We'll slide over here. Now, I'm happy to have NAMI board member and Commonwealth's attorney, Jonathan Gay, recognize our next recipient.
Good morning, everyone. I'm Jonathan Gay. I'm the Commonwealth's attorney in Mason, Fleming, and Bracken County. That's the 19th Judicial Circuit. And we're here today to give an award called a Commitment to Service and Compassion Award for a law enforcement officer who has exemplified the role that we see in crisis intervention that our law enforcement faces every day dealing with folks in mental health issues. Chief Deputy Rob Kahn will be our recipient. And I just want to read to you this award nomination made by Sheriff Smith, and then we'll ask Sheriff Smith and Deputy Rob Kahn from Fleming County Sheriff's Office to come up and spend some time with us. So, Chief Deputy Rob Kahn serves with the Fleming County Sheriff's Office. bringing over 30 years of law enforcement experience. He's a retired state trooper, known for his dedication, professionalism, and unwavering commitment to public safety. One recent episode stands out as a testament to Chief Deputy Kahn's dedication to going the extra mile for those suffering from mental health crisis. In November 2024, Chief Deputy Kahn responded to a call involving an elderly homeowner who reported assailants attempting to break into his residence. After thoroughly sweeping the home, reassuring the gentleman that no one was present, Deputy Kahn left the scene. However, later that day, the homeowner contacted Fleming County Dispatch a second time. He reported another break-in. Upon arrival, Chief Deputy Kahn quickly determined that the man was experiencing a mental health crisis. The homeowner spoke of skinwalkers and paranormal activity before beginning to fire shots inside his home and at law enforcement officers stationed outside. Despite the immediate danger and the risk to his own safety, Chief Deputy Kahn took control of the situation with remarkable composure. Exercising patience, restraint, and compassion, he successfully de-escalated the crisis, ultimately convincing the gentleman to surrender peacefully. This incident underscores both the dangers that our law enforcement face when responding to mental health emergencies, as well as the critical importance of their ability to act with empathy and professionalism. Chief Deputy Kahn's actions exemplify the courage, dedication, and compassion required to serve and protect the community. And I just want to, before I have Sheriff Smith come up, I want to give you one final anecdote about the compassion of this officer and professionalism. I'm a newly elected Commonwealth attorney, and my first response was indignation when I'd heard that there was someone out shooting our law enforcement community. And I texted Rob and I said, this really bothers me, and we're going to bust his you-know-what when we get him in circuit court. Rob responded, "Yes, sir, thank you. Poor man. He is obviously dealing with some mental health issues. We will get with you before grand jury and look at court-ordered help in lieu of jail." This is someone who had just shot at our officers, and our officers' first response was to get them help. So without further ado, I'd like to introduce Sheriff Smith, who will bring up Deputy Kahn.
Good morning, Sheriff Smith, Fleming County Sheriff's Office. It's an honor and a privilege to be here today to help present the award to one of my good friends and Chief Deputy, Rob Kahn. Law enforcement go above and beyond every single day, and it's great to know that we've got Deputy Kahn in our area, in our community, to keep our people safe. Chief Deputy Kahn.
I'm honored to be recognized, but I don't really feel that I've done anything other than what I'm supposed to do. When I joined 30 years ago, I joined to protect and preserve life. I want to thank Sheriff Smith because he also had the forethought that we go through scenario-based training and actually had scenarios just like the one I was involved in, which makes responding so much easier. But again, thank you all.
There are a lot of unsung heroes in this state. And it's great when you can identify one and sing their praises. We thank you for your service, Deputy and Sheriff. The next award, we were talking in the planning of Advocacy Day. We kind of start talking about it, for the coming year, a little while after we do this. And we thought about it. Felt, unfortunately, he a little under the weather and couldn't be here today. He's doing okay, though. He's on the mend. I spoke to him yesterday. I didn't share it with him that I was telling him I was really saddened that he couldn't be here, but I'm especially saddened that he couldn't be here. But we're going to take this to him. But I want to talk about him a little bit. He's the reason that I got involved with NAMI Kentucky. And he is our current longest serving board member, Eddie Coleman of Pike. And how Eddie got involved with NAMI Kentucky is a great story. Eddie has a family member that suffers from mental illness. And many years ago, he made weekly trips to go through a program offered by NAMI Lexington. How many weeks was that program? 12 weeks. And, you know, at that time, I didn't know it was all it would be. And it really had a profound effect on him. And he made a lot of friends with people from the NAMI Lexington community, the NAMI Kentucky community, and made his way onto the board. And then a few years back, very honored and on
I'm going to back you up just a little more. So yeah, fine right there, please. Thank you. So light coming on, sir.
In the executive director, we function as our interim executive director.
Sir, help me get a microphone, please.
Okay.
Say and spell your first and last name.
So Jonathan, Johnathan, last name's Gay, Gay.
Do you have a title, sir?
I do. I'm the Commonwealth Attorney in the 19th Judicial Circuit.
And your connection, NAMI, please.
I'm a board member of NAMI.
Sir, stay right where you are. Look right your name. What's going on here today?
So what we're doing today is honoring and recognizing some of the folks that are vital to our mental health community in Kentucky. And I've just had the privilege of giving out an award to a law enforcement officer who responded and exercised remarkable composure in a mental health crisis.
Let's talk a little bit about your organization and its purpose for being here today.
Today's Advocacy Day for NAMI, so it's National Alliance of Mental Illness Kentucky. It's a national organization, and this is the Kentucky affiliate. And we're here today to advocate on behalf of mental health.
And you had Lieutenant Governor speaking here for that. I must have been very supportive.
It was great. The Lieutenant Governor and the Governor have both been stalwart champions of mental health, and we're very grateful for all that they've done.
Do you feel that this condition, if we could call it that, has been vastly ignored for a while and is now being personal or something watching more from?
I do feel that mental health is overlooked and treatment options are overlooked. There's a stigma that we deal with in mental health. And unfortunately, it's not something you can sweep under the rug. You know, it's something that I, as a prosecutor, deal with on a daily basis. So we have to try to find ways to treat people and to get them help so that they're not out committing crimes, they're not out committing crises, and we're able to get them the support they need.
Sir, during this Advocacy Day, we're having a rally here under the rotunda. What is next?
So I think next is to continue the fight. I think we have to continue the fight, continue supporting those modules that will ultimately support mental health. And the great thing is there's a lot of support. I think that mental health is becoming less and less stigmatized in Kentucky, and we just have to keep up the hard work.
And is there anything that I'm not asking you that maybe you could share with my viewers about today or the purposes of NAMI?
I would just say mental health is health. And so if we want a healthy Kentucky, we have to support and embrace mental health treatment.
Thank you, sir.
Thank you.
Thank you. Especially when you have problems, it's all use conferences. can be a very hard thing to talk about, but you are going out having difficult conversations. Because you're having those difficult conversations, things are changing. I work a lot in the youth mental health. I'm what's known as the peer support specialist. Um, And, teenagers, just like persons, they need help too. And I've been very lucky in the past to advocate for youth mental health and things like that. And from what I understand, it's something that you are advocating for today. And that's so incredibly important. Because those teenagers, they have stories just like you and they're going to have to come up in this world, and hopefully the change is there for them to live a more healthy, mentally and physically healthy life. Before I take off, I wanted to kind of throw this in. Again, I know from personal experience that talking about this especially if you are correct. Whether you are
is Olivia. Though she has yet to greet the outside world, she has already completed an amazing journey. This is the moment that life begins. A new human being has come into existence. At fertilization, her gender, ethnicity, hair color, eye color, and countless traits are already determined. She begins to implant in the uterus about 1 week after fertilization. Her cells organize into what we call an embryo. At 3 weeks and 1 day, just 22 days after fertilization, Olivia's heartbeat can be detected. The buds of her arms and legs appear like organs. She begins to move between 5 and 6 weeks with both spontaneous and reflexive movements. At 6 weeks from fertilization, her brain activity can be recorded and bone formation begins. She can bring her hands together at 7.5 weeks, and separate fingers and toes emerge. She can also begin to hiccup. At the beginning of the month, Olivia was growing from a single cell into nearly 1 billion cells, and she is now called the fetus. She will suck her thumb and swallow, grasp an object, scratch her face, sigh, and stretch. At 11 weeks, she is playing in the womb, moving her body and exploring her environment. Her taste buds cells have matured by week 12, but are still scattered throughout her mouth. Her mother will first send Olivia to you between 14 and 18 weeks, an event called quickening. Beginning at 18 weeks, ultrasound shows speaking movements in her voice box. Around 20 weeks, with a lot of help, babies have survived outside the womb. At 27 weeks, her eyes are responding to light. She can recognize her parents' voices and will even recognize lullabies and stories. Olivia has gone on an amazing journey during these last 9 months. She will soon signal to her mother that it is time for delivery and greet the outside world.
Century. This march has united tens of thousands of Americans from all walks of life to rally for the cause of life in our nation. It is the single largest gathering in the world to celebrate our movement, the victories we've fought so hard for, and yes, the victories yet to come. And I want to personally welcome all of you who traveled from far and wide to our nation's capital. Thank you for your dedication, and it is an incredible crowd, and it's great to see you today. As you all know, the event theme this year is Life, Live and March. And there are obvious answers to the implicit question it poses. We march to protect the unborn. We march to proclaim and live out the sacred truth that every single child is a miracle and a gift from God.
If I could have your attention, Kentucky Rights Life pro-life student ambassadors who will be meeting with the Kentucky General Assembly. Please make your way to the top of the steps at the front doors of the Capitol, where your host will escort you through security to meet with the representatives and senator at 11:15. Thank you.
You might want to talk to Shane. What?
For like interview?
Yes.
Hey, everybody,
There's a couple
make
pastors
your
here
way
that I
in
think
this
would be good
direction.
to talk to. Trying to see like Peyton.
I'd like to introduce to you Stu Embry and Shelbyville Christian Church for some praise and worship.
I'm fine with doing an interview, but I'd like to give them the opportunity first.
Sure.
But
Sure. Rhetoric's a little bit more practice.
It's good to see everybody. What a beautiful day we have. We got here.
Peyton's right there.
To celebrate, to lift up the name of Jesus, and just come together. And unify in the name of Jesus Christ. This first song I'm going to sing, I hope that you know it. It's called Battle Belongs, and I know that on these grounds there have been some battles. You know, maybe creating wall, whatever the situation. But we know ultimately that the battle is won when we're on our knees and when we're in prayer. We're fighting against flesh and blood, against principalities. So it's through our prayers God works, amen.
Trying to get the feel on.
All I see is battle. You see my victory. All I see is a mountain. You see a mountain. As I walk through the shadow, your love surrounds me.
Interview? Yes, please. I'd love to talk to you. That'd be great.
There's nothing fear.
Yeah, for sure. This way.
So did I find right on my knees with my eyes lifted high. Oh, that belongs to you. Every year, lay at your feet. I'll sing tonight. Oh, God, that'll belong to you.